This is Kumari Surabhi. Today I am going to do complete cranial nerve examination. 12 pairs of cranial nerves emerge from within the skull, mediate complex motor sensory functions. Cranial nerve 1 and 2 are actually fiber tracts emerging from the brain. Cranial nerve 3 to 7 arise from diencephalon and brainstem. Several of the cranial nerves are specialized, producing smell, vision, or hearing. Examining cranial nerves. I begin by introducing myself, confirm patient details, explain procedure, then gain consent of my patient. With patient health history in mind and after good hand hygiene, ready for the physical examination. To examine cranial nerve, I begin with cranial nerve 1, the olfactory nerve, which mediates sense of smell. To assess its function, first be sure each nasal passage is open by compressing one side of the nose and asking the patient to sniff through the other. With eyes closed and one of the patient's nostrils occluded, pass a mildly aromatic and familiar substance such as vanilla, clove, cinnamon, or coffee under the open nostril. If patient detects smell, ask to identify from other nostril. Now cranial nerve 2, which is optic nerve, which mediates vision. To assess its function, check patient visual acuity, visual fields, and remove glasses if necessary. Inspect the optic fundi of both eyes. Also look for papilledema, pallor from optic atrophy, and any cup enlargement suggesting glaucoma. Cranial nerve 3, 4, and 6, the oculomotor, trochlear, and abducens nerve. These three nerves control eye movements. Because these nerves work together so closely, they are examined as groups. Check the extraocular movements in the six cardinal directions of gaze and look for conjugate movements in any of the six directions, which causes diplopia. Inspect the eye closely for asymmetric deviation of movement. Determine if the diplopia is monocular or binocular by asking the patient to cover one eye or perform the cover-uncover test. Test for convergence of the eyes by asking the patient to look at your finger as you move it toward the bridge of the nose. Identify any nystagmus and involuntary jerking of the eyes with quick and slow components. Note direction of gaze, plane of nystagmus. Nerve 5, which is trigeminal nerve. It innervates the muscles of mastication. The sensory portion of the nerve mediates facial sensation and the sensory part of the corneal reflex. To palpate the temporal and masseter muscles, ask the patient to clench the teeth. Note the strength of muscle contraction, then ask the patient to move the jaw from side to side. Sensory portion of trigeminal nerve has three divisions: ophthalmic, maxillary, and mandibular division. To test sensory portion of the trigeminal nerve with the patient eyes closed, test for pain sensation using the sterile sharp end of a broken cotton swab stick or some other suitable sharp object to stimulate the patient's forehead and cheeks at the points indicated. Occasionally, substitute the dull end for the sharp one as you test scattered areas. Compare symmetrical areas on both sides of the face. If suspect on abnormality, confirm it by testing further for temperature sensitivity by using two test tubes filled with hot and cold water. Test for light touch using a wisp of cotton. Ask patient to respond whenever you touch the skin. To test the corneal reflex, Prepare fine wisp of cotton. Approach the patient from the side, out of line of vision. Lightly touch the cornea with the cotton. Normally, patient's eyes will blink and get teary. Cranial nerve 7, which is facial nerve, innervates all the muscles of the facial movement and expression. Also mediates taste sensation in anterior two-thirds of the tongue. Patient's face at rest and during conversation. Note any symmetry and look for tics or other involuntary movements. Ask patient to show teeth, close eyes so tightly that you can't open them. Wrinkle patient forehead, puffs out cheeks and tense neck muscles. Normally, patient can do these maneuvers easily and symmetrically. Cranial nerve 8, which is acoustic nerve, mediates hearing and vestibular function. Assess hearing with the whispered voice test. If hearing loss is present, test for conductive or sensory neural test. Test for air and bone conduction by using the Weber test and lateralization using the Rennie test. Cranial nerves 9 and 10, which is glossopharyngeal and vagus nerve, mediate sensory and motor functions of the palate, the pharynx, and the larynx. To test, ask the patient to yawn as observe the soft palate in pharynx. Soft palate should rise properly and symmetrically. Uvula should remain midline and each side of the posterior pharynx moves medially like a curtain. Gag reflex, which consists of elevation of the tongue and soft palate and constriction of the pharyngeal muscles, stimulate the back of the throat lightly on each side. Note the gag reflex. Cranial nerve 11, which is spinal accessory nerve, innervates the sternomastoid and upper trapezius muscles. Behind, ask patient to shrug shoulders upward against your hands. Evaluate the strength and contraction of the trapezius muscles. 12, which is hypoglossal nerve. It mediates tongue's motor functions which affect articulation of words. First, listen to the patient's words. Inspect the patient's tongue as it lies on the floor of mouth. Observe for atrophy fasciculations. Some coarser restless movements are often seen in a normal tongue. Ask patient to stick out his tongue. Ask the patient to move the tongue from side to side and note symmetry of the movement.